Hi, everybody. Good evening and welcome to the broadcast. Tonight is a broadcast that was actually requested by parents. I had made some reference to a book or concept from a Buddhist book about mindfulness and psychotherapy, and somebody asked me for that reference. So I decided to go back and really re-listen to this book because it's an audio book. I can't find it available on a print version. And it comes from 3 lectures given by Thich Nhat Hanh on the relationship between mindfulness and psychotherapy. Specifically, the idea is about training psychotherapists and how can mindfulness and Buddhism inform them. But like I always do, I think that there's wonderful application for parents. I think about the parent-child relationship, the client-therapist relationship. I think about those very similarly, even in my own family, that there are principles that apply in both ways. In fact, I think sometimes when people are saying to somebody, don't be my therapist, in the role of a parent, really what I've found in my work is that if you're doing good therapy, it's very much the same. It's what people really mean by that is they mean don't be a bad therapist to me, because a therapist is an adequate container. A therapist is capable of holding space, holding a place for the client, for the individual, and what they bring to the table. And the more I've done this work, the more I see the parallels and the similarities between the way we treat our children, the way we treat our clients, and the way we treat somebody walking down the hall. So with that preamble, let me get into tonight's concepts. And I think these are wonderful principles for parents. I think they're wonderful to help us in our journey of parenting children that are struggling with issues. And the first concept is the idea of enjoying peace. And Thich Nhat Hanh often says that peace, serenity, a sense of well-being is available in the present moment. And that can be extraordinarily challenging for a parent. There is no greater challenge that I know of than dealing with the pain and struggles that our children have, dealing with the harm, with the danger that they're in. And so it's a lofty idea, a lofty goal that pain and suffering, that we can reduce those and we can find peace and serenity in the present moment. I love this idea and I think about it often. In fact, I don't think about it enough, and I think that's one of the principles he's trying to teach, is that when we get a toothache, and I think most people can relate to this, when we get a toothache, we get some enlightenment along with it. And the first bit of enlightenment we get is that we weren't paying attention to our non-toothache, right? Most of us take for granted right now, I assume nobody on this webinar necessarily has a toothache. Have you thought about not having a toothache today? And of course not. Not unless you're a mindful, practicing person and you're doing body scans and paying attention to your body. You're not going to think about that. You're going to take that for granted. And I think wilderness does that very well. Being out in the elements. You develop a sense of gratitude, of appreciation. Nothing can be taken for granted. Warmth, shelter from the sun, the snow, whatever it is, can't be taken for granted. And so you gain a kind of depth of awareness and understanding about all that we have in life. So when we have children that are suffering, that are struggling, and focusing on being consumed by that quote-unquote toothache can be overwhelming. But the practice of mindfulness is to pay attention to the things that aren't hurting, that aren't suffering as often as possible. He talks about this idea that peace is boring, that peace doesn't compel us, that it tends to lead to a life where we take things for granted. And mindfulness is the antidote for that. That if we practice and concentrate on our lives, on what's going on, what we're feeling, what we're thinking, how our body is, what we're present with. I'm going to talk tonight about the idea of a flower in the garbage. This idea that we can see in a flower the entire universe if we look closely enough. We can see the sunlight, we can see the soil, we can see the water. But more profoundly, Thich Nhat Hanh talks about this idea that potentially if you have the capacity, if you have the practice, you can also see the flower in the garbage, right? That garbage can someday again become a flower. He talks about this idea, makes reference to this idea that drinking, drugs, sex, all of the behavior that our children are often sent to evoke for are attempts to seek escape from mindfulness. But that healing and psychological growth happens as a result of mindfulness. Therapy is a kind of mindfulness. He makes the point that even therapists who don't consider themselves to be informed by Buddhism, who don't consider themselves to be mindfulness practitioners, are mindful people. They're sitting with people, trying to find what Thich Nhat Hanh calls their suchness, right? Their essentialness, who they are. Trying to understand their story, their feelings, their thoughts, their history, what makes them them, all that makes them them, all of the non-elements of them that make them them, that have contributed to them and their suchness. So therapy is the opposite of escape. Therapy is learning how to feel. I've talked about this for years, that when I explain this to my own children when they were young, what I do for a living, because being a therapist, it's complex to explain to a 3, 4, 5, 6, 7-year-old what you do. And I explain that I'm working with the sad boys and girls. I worked with boys most of my career. I'm working with the sad boys to help them feel. And more simply, I said to help them feel happy, but really it wasn't about making them feel happy. It was helping them to feel that the symptomology, right, the neurotic behavior, the behaviors, the problematic behaviors that become organized in such a way that we call them diagnoses. Right? They organize themselves in predictable patterns. That's a diagnosis. That those are the voice of our unexpressed, unfelt, unmetabolized emotions. And so therapy, when a therapist says, how do you feel? They're really asking you to feel, right? To focus on it, to concentrate on like the non-toothache, to concentrate on what is present, to not run away from it. He talks about this idea of mindfulness and the greatest scope of life, using the idea of a disposable diaper. That if you throw a disposable diaper away mindfully, you're going to find it very, very difficult to do that, because you recognize it's going to take 3,000 or 4,000 years to disintegrate, to go back into the earth and be useful. And so he also talks about this idea of drinking, that if you drink alcohol mindfully, which is a contradiction in and of itself, that you'll eventually not desire drinking. And in a sense, that's what's happening in therapy and 12-step support groups, right? They don't call it mindfulness necessarily, but it's this idea of, how am I feeling? How is this leaving me to feel? I'm feeling worse. I'm paying attention. I'm not ignoring the question about what's going on with me. And recognizing peace at the present moment. There's a lot of talk in Buddhism about this idea that peace isn't the goal, it's the way. And I think for parents, that's hard. So many parents, understandably so, seek out this work because they want to find a solution, because they're in crisis and they have a problem. Their child has a problem that they share with them. But what this idea teaches us about mindfulness is that we find the peace in the moment wherever we are. It's what I talk about when I say that this is not a detour, right? This idea that I want to get back on track. I want to get back to the way things were going. But learning to embrace where you're at, and then having access to all the wisdom, all the treasures, all the enlightenment that this struggle has to offer, is this peaceful way. But when we get at odds with what is happening, when we make ourselves an enemy to what is happening, by simplistically trying to fix it, change it, or alter it, we miss it. And so it's about, there's some things I'm going to discuss this evening that I love. It's about changing your relationship to the problem. It's about changing your way of being to the problem. And by that matter, about your way of being here on earth. And I want to be as clear as I can. And this webinar, this broadcast is going to be a little bit esoteric, because these are fairly esoteric ideas. They're not the practical kind of things. But in all of those skills, those basic tools we teach, from the I feel statement to reflective listening, in those concepts, those tools are the seeds of this. Right? The I feel statement asks you to simply state what you're thinking and feeling, what you're hoping for, and asks the receiver just to hear it, to be present with it. Now, we don't talk in these Buddhist ways, but that's essentially what it is. Mindful breathing and paying attention, concentration, calling these things by their name, paying attention to what's going on in your life, naming it, putting a magnifying glass on it, a microscope on it. The kids will talk about this so often in the field. They have this experience out there that a week goes by like a day and a day goes by like a week. At the end of the day, there's an awareness of how much energy has been spent. And that's because their concentration is so heightened. People that are new to therapy, I see this all the time. I see this at our intensives. I see this out in the field. I see this whenever I get a new client. They don't realize how much energy this work takes. And it takes a lot of energy for a therapist. This webinar takes a lot of energy, right? To hold space, to stretch ourselves, to do this work. Even the frustration that a lot of people feel the first few times they listen to my broadcasts, and if this is one of the first times you're listening to it, I apologize, because again, this is not an entry-level webinar broadcast. It takes a lot. I applaud people that are willing to come back a handful of times after it being difficult. And I really, really am glad to hear that people, after they listen to it for a while, will say, I didn't understand it, or I didn't like it at first, and now I get it, now I hear it. So mindfulness is about stop thinking and just being, right? We're not thinking, we're not present, we're not somewhere else, we're not in the future. We talk about in the field about no future information. It's a technique really that's about encouraging our clients and students to be more present, right? If you're focused on the finish line, I've run several marathons and a couple of Ironmans and several other races. One of the things that gets me through the pain and discomfort at times is I think about the finish line, about the elation that I'm going to feel at the finish line. That can be effective for short-term discomfort to distract myself from it, although Buddhists would encourage me not to do that. But it can be an effective way of getting to the end goal. But it doesn't work for long-term, sustainable health and well-being. So what we ask children to do, what we ask clients to do, is to stay in the present moment as much as possible, parents also, in this process. When we stop thinking, we become less anxious. When we stop thinking about the past or the future, about things that we can't control. I was talking with a parent recently about this idea that really therapy is about having a dialogue with somebody, with a parent coaching that is. It's having a dialogue with somebody and through the dialogue, helping the parent to understand that there are a couple of piles in their life of things, of ideas, of concepts. Some of which they have no control over, and some of which they have control over. Once you start to understand what those things are, right, it becomes much easier. But in this thinking way, we end up rehearsing, going over in our mind, trying to fix things, trying to control things, really focusing on things that we can't control, that aren't here and now. Mindfulness, a formal mindfulness practice can be a rest from your anxiety. Thich Nhat Hanh talks about doing it for a practice for a time, just 5 minutes of mindful breathing or mindful walking or mindful eating. And when you do that, you get a rest or a break from your anxiety. I think that's what I talk about in some ways when I talk about parents needing to take care of themselves, to feed themselves, that your children, the children that end up in this program, require more capacity, more energy, more resources than the typical child, let's say. So what that idea asks of you, what your story asks of you is you need help. You can't do it on your own. Maybe you can try, and maybe you're that resourceful, that strong, have that much energy. But to be patient, kind, loving, and curious in the face of frightening things, difficult and painful things, is a tall order for most people. He uses the story through his 3 lectures in this audiobook over and over again, the idea of there's this famous old story of the Buddha who stands up and he holds a flower. I think he's standing in front of 1,100 monks. And they stand there in silence while he stares at this flower. And the Buddha notices that there is one monk that gets this big bright smile on his face. And he recognizes that one monk sees it, which is everything, right? This Zen idea that in the flower is the universe. In a dust particle is the universe. It's a part of it. It's required for the universe to exist, for that flower to exist. But to take it back down to earth, back down to more practical, it is to see the bigger picture. I talk so often about the long game and the short game. And I think so many of the challenges that parents get into is they're trying to win the long game. That kind of stress and anxiety in a family and on a relationship doesn't work. And so part of the perspective that a therapist working with your child can give you is to take a step back and say, these things take time to develop. There's a great movie. I believe it's called About Time. It's a fantastic movie where a strange concept where when the men in this one family turn 21 years old, they have the capacity to go back at any moment in time just by thinking about it, by concentrating on it. And so the young man who turns 21 and finds out from his father that this is the superpower that this family has. He wants to learn about it. And he asks his father at one point, he asks him, what would you recommend? What did you do with this? And his father said, I would recommend that you try living every day twice. And while that might seem like a simple or even strange idea, it was really profound. Showed the guy, I think he was a lawyer, running through a busy office building, dropping papers, being frustrated, anxious to get to the trial or the meeting on time, whatever he was doing. And of course, at the end of the day, at the end of the process, whatever it is, everything was okay. So when he goes back and lives that day, knowing in his mind that everything is okay, he walks through that same lobby and he notices the smells and the sounds and the beautiful artwork in the building. I was telling somebody this just recently. When my son was 15, 16, all of the friends in the neighborhood were numbskulls, right? They stole stuff from our house. They lied. They did ridiculous things. They got caught and arrested for alcohol, whatever it was. All those types of things, right? The kids do. Brainless activities. And now they're all in their mid-20s, and I am shocked that by and large, almost all of them are incredibly sensitive, caring, some cases married with families, empathic, wise-minded young men. And if I had just known, right, if I had just known that was going to happen 10 years ago, I could have relaxed a little bit more. It doesn't mean, folks, that you become passive and inactive in this process. But what it means is that you have peace and serenity. And having peace and serenity changes your ability to parent, to be in relationship in a much more healthy, grounded, concentrated, authentic way. So part of our work, part of my work with you, part of the therapist's work with you at Evoke, part of the work that goes on in meetings is you go someplace to manage your anxiety, to take care of it. And you have a lot of it, and you deserve a lot of it, right? You're not crazy to have it. It's earned anxiety. But you manage it, take care of it, metabolize it there. Then you come back to the child in this case, or to the client in any case, and you offer them your love and support and your understanding. Learning to become in touch with your non-toothache. Learning to become in touch with, we talk about this all the time in therapy. When you can't see the strengths in your client, when you can't see what you have in common with them, you're doing it wrong. When you can't even see, and this is a tougher one, the wisdom and what's going on, or in other words, as Thich Nhat says, when you can't see the flower in the garbage, because that garbage is eventually going to be a flower, when you can't see that, you're doing it wrong. Like my colleague said at a conference a few years back, underneath or in the middle of or amongst all of that anger that a lot of these adolescents have is great power and great wisdom. And so that's part of what we develop, is the capacity to see that. I can do that a lot easier when it's not directed directly at me or personal. I can do that when it's not my own child. It's harder when it's my own child. That's why in my own family, I have to get help. In your family, I do it a little bit easier, a lot easier, frankly, in your family. In therapy, we call it part of this. Part of this is encompassed in an idea called a strength-based approach. I made reference here to the anatomy of peace, or to leadership and self-deception, where we actually become committed to the failure of the system unconsciously, right? The example in one of those two books that teach the same theory is when the son comes home after having lots of problems with just a minute to spare in his curfew, and the father says reflexively, he says, "Cutting it kind of close, aren't you?" And of course, the son just drops his head and walks into his room. Right? We need to justify the anger that we have, so we look for facts that confirm it. It's a way of self-protecting. And just seeing what is, the kinds of judgments and conclusions that we arrive at everything, at ourselves, at our children, at a situation, can be such a negative contribution to this process of finding inner peace. I love this story told to me. A master composer sat down in front of a royal court and played a beautiful sonata. And when he was finished, the king said to the master composer, he said, "What did that mean? What is that about?" And the composer sat down and played it again. That this is what is. You have a child with bipolar, with depression, with substance abuse disorder, with a lot of anger, with other mood disorders, with ADHD, with autism spectrum disorder. It's not what you signed up for. It's not what you expected. And that disappointment because your expectation isn't realized causes you suffering inside. But if you can find the teacher in the student, if you can find the teacher, the lesson, the wisdom that it has to offer, and it cracks you open and it hurts you, you can find peace in the present moment. All right. Whoa. Sorry, my slides are having a difficult time. Oh, I apologize. We'll have to edit this out. Suffering. I'll talk for a few minutes about suffering. He tells a profound story, and I've seen it, I've heard it, and read it in different teachings of Thich Nhat Hanh. He talks about the story of a Vietnam vet who, after his a group of the soldiers that he was with, his troop, were ambushed and murdered, he felt such anguish and pain that he took it out on several children in a small village. He now, many years later, couldn't be around children, was traumatized by children, carried deep and great regret for the crime against humanity that he had committed. And Thich Nhat Hanh spent a lot of time with them. And after a while, he said to them, there are children suffering today all over the world. And what you can do is you can spend time serving them, feeding them, rescuing them from war. And this man went on to do just that and save what I'm led to believe is hundreds of children's lives. I work with parents all the time, and they express a lot of regret. And regret is such a fascinating idea. Right? It's something that we do to punish ourselves. I think it comes from this idea that guilt was something that we were told when we were children would keep us in line, would keep us safe. So that when we make mistakes, when we do something stupid or ridiculous, that somehow we've had this feeling that's going to protect us, and that we almost hold on to it to treasure it. And I've thought about this for years now. Like, so you did. Let's assume you're a scoundrel. Let's assume you've screwed up. You can do a couple of things with that. You could beat yourself up over it, or you can learn from it and make a difference going forward. There's opportunities in the present moment to take the wisdom that you've learned from that choice and make a difference. But if you spend your time and energy on regret, you don't go anywhere. This is a pretty big transformation for me, because I used to try to help people with their shame and guilt as parents by talking about them being good enough parents. I used to talk about this idea that you can be accountable and aware without blame. But Now more and often I think, okay, so you made mistakes. You leave dents in your children. We all do, some more, some less. But the self-judgment, the lack of compassion that you feel toward yourself doesn't do anything to help anybody. It keeps you stuck. If anything, it prevents you from repeating the exact same problem. So part of the work is to learn to let go of that, to learn to let go that that idea that guilt would keep you in line and teach you and guide you toward morality was not true. That this idea, this way of loving, of self-forgiveness, right? When one experiences grace and forgiveness, it can be the most powerful and healing force in all of nature. A lot of us are afraid of grace because we're afraid it's going to somehow open up all the possibilities that if there's grace in the world, I'm not talking about a religious grace, I'm talking about a psychological, emotional grace of forgiveness and understanding. Think about the movie, or the play, or the movie, Les Mis, where when Jean Valjean is caught stealing and he's brought back to the owner of the house said, you forgot the goblet, you forgot something else, and gave him more. And what that author, what Victor Hugo was trying to show and teach was, once he experienced that grace, that absolute grace, he wanted to do nothing more for the rest of his life than to live and to love others. So I would challenge you to think about the value of regret and to make meaning out of the suffering, to make meaning out of the mistake, to learn from it, to use it to get peace and serenity in the present moment. Learning what is in your control. The past is definitely not in your control anymore. Right? And if parents stay stuck in regret, anybody for this matter, stays stuck in regret, it really ends up that the child has to then take care of the parents and make them feel okay. But if the parent, or anybody for that matter, takes on the responsibility for, again, moving through it, allowing it to move through them, letting it go, then they can be there for the child or for the other person. Breathing, a kind of standard classic meditation can bring you to the present moment. It can give you a rest for your problems. He talks about this idea again of how our suffering, our pain in life makes us aware of our joy. And I tell this story years ago where a friend of mine, who I've known for 22 years, had a daughter born to him with a very rare skin disease, where her skin didn't scab over. It would be easily blistered, and it lacked the ability to regenerate easily. And so she was always getting sores all over her body and on her esophagus. And when she was born, they tragically predicted that she would last 12 years. And that's about almost exactly how long she lived. And I remember toward the end of her life, watching my friend on social media laying next to her as she was dying. And I remember I just couldn't tolerate it. Sometimes I would take a screenshot of his post because I couldn't take it all in. And I was talking to a mutual friend of ours that I bumped into one time, who happened to be also a Buddhist, and I was telling him how hard it is to watch our friend go through this. And he said to me very, very gently, very kindly, he said, yes, but that pain that you have means that you love. It means that you're alive. And all of a sudden, that idea transformed my pain from something to avoid and to run away from, to medicate, to escape, to something to cherish. When I could see in my pain the joy and the love and the life, I didn't need to run away from it anymore, and I could tolerate it. That's the idea, is when I can see in the garbage the flower, then it offers me the peace. Obsessing about the past. Again, I think for anybody, he talks a lot about this idea of obsessing about the past, and talks about an idea that therapists sometimes facilitate and encourage that. I'll add one amendment to the idea that many people have never processed what they needed to move through it, right? So to have experienced it and to not have made it a piece of work, that can be a problem. So typically therapists want you to go through some of it. But the goal of going back to it is to move through it, if you had been abused or raped or yelled at or bullied or forgotten or whatever it is, and you never dealt with it. That pain is likely to come out symptomatically. And so there's this idea that therapy can keep you stuck, but I would propose that good therapy is going to move you forward. It's the bad therapy that can keep you stuck. There's a concept, a saying that he refers to in Buddhism that says there is no way to peace, peace is the way. There is no solution to your child's problems. The solution is in the sensibility with which you participate. And then you'll be there. Doesn't mean your child's problems will be over. You'll just see them differently and have a different relationship to them. They will cause you a different kind of feeling. You'll be more capable and able to respond to them. That's why the questions, and I always say this, are never what do you do, but who are you and what's your relationship to your child and their problems. Meditation can be in many forms. There can be the classic lotus position breathing meditation. You can walk and meditate. Many people do that in the wilderness. You can have an eating meditation where you slow down, you taste the food. I've done this many times in my life, and it can be a powerful emotional experience to recognize eating a strawberry, everything that's gone into that strawberry to get to my table, all the sunlight that went into it, all the effort, all the care, all the rain, so forth and so on. And then talking therapy. Talking therapy can be a meditation, right? It's a concentration and a focus on what you're feeling and thinking, wanting, hoping for, attached to. It's a way of putting a focus on you. And I want to say this, that he makes this really great point, that it's okay to help yourself. In fact, it's essential to help yourself. Because when you help yourself, you're helping the world. And I think, again, there is this idea in parenting about selfless parenting. My experience is often that people who focus on, often, not always, but focus on selfless parenting end up becoming some of the most selfish parenting. And I don't even like that word either. But they don't know how to take care of themselves, and so inadvertently they ask other people to take care of them constantly. So part of your charge, part of your charge of being at Evoke, I know it wasn't what you signed up for, but is to take care of yourself. It's essential. Because if you don't know how or what that means, find somebody, talk to a therapist, talk to a sponsor, a mentor. Find out what it means to take care of yourself. You will end up asking other people to do it for you. But the crime in all of that is that it won't be overt. You won't know that it's being asked, and they'll be feeling it come out of them. And there'll be confusion and resentment. So take care of yourself, especially in relationship to your children. Because if anybody in the world does not have the charge to take care of you, it's your children. It's the other way around. It's our job to take care of them. Parents who say, my child doesn't love me anymore, they don't look up to me, they don't appreciate me. And in those behaviors, there's often some pathology, there's some issues. But that's not the measure of mental health, right? It's not our children's job to love us and admire us, right? This parenting thing is a top-down kind of love flow. And ideally, if we're taking care of ourselves, if my cup is full, I don't even ask. I don't pay attention or see what's coming up because I'm adequately filled. One of the grandparents of our children said years ago something like that, like the children they're not excited when I come over, and my response to them was, it's not their job to be excited when you come over. It's your job to be excited when you come over. It's not their job to meet you where you're at. It's your job to meet them where they're at. And so what that's going to require parents with children who are struggling is a lot of work, a lot of healthy, assertive self-care. Of course, this is something we talk about all the time, this idea of outcomes. This is not a discussion about outcomes. And the irony of this idea of the journey over the outcome is that it works to get the outcomes that you want, ironically. When you can have peace, serenity, compassion, love, patience toward yourself and toward them, you parent more effectively. And you get the outcomes that you want, but that can't be your focus. Controlling toward that end. You do it because it is its own reward in and of itself. Learning to be present with your child. There's a lot about being present and the capacity to hear. I love the phrase that he talks about where you learn to know their suchness, who they are. And I don't think we do as well as we think. I think a lot of parents mistake this idea for how much they love their children with how much they know them. You love your child more than I do 100 days out of 100. But that doesn't mean you know them more and have a better vision. That requires a lot of self-awareness, right? That requires a lot of work on defining who you are, where you stop and what you start, what your relationship to them is and what it's not, what's inside your control and what it's not, what's your job and what it's not. So, and that is what leads to an awareness of their suchness, of their essence, of who they are. And that takes a lot of practice. I'll refer you again to the podcast that I've mentioned several times. The podcast on Invisibilia, July 1st, 2016, The Problem with the Solution. I won't say a lot about it because I've mentioned it a few times, but I just recommend it to you. It's a fantastic one that illustrates some of these concepts in a very different way. He talks about this idea of non-duality, that we see the student, we become the student as well as the teacher. When parents say to me, and I've had this not often, but on occasion, when parents say that one of their goals and objectives is that their child will get into a place where the child will listen to their wisdom. And my response is, that's not, I don't think, going to be the most important thing. The most important thing is going to be how well you can listen to them. And he talks about this idea that to be a good teacher, you have to be a good student. I teach my therapists all the time. If you're not learning as much or more from your students, from your clients, then you're doing it wrong. Same with us as parents. But we have this idea where we're the ones doing all the teaching. And there's this concept that I'd present to you today, that the children were sent here to teach you what you need to learn, and they'll stop teaching you it when you don't need to learn it anymore. So always be the student. Be not knowing. Be open. Be humble. Talk about your not knowingness. Talk about your struggles, your mistakes. Apologize. And parents worry, well, that my child will use that against me. They won't. That only comes from a dynamic, a paradigm where there's power. If you apologize, let go, surrender, are humble for the right reason because it's its own reward, nobody can use it against you. It's actually impossible. And besides, in families, most often what I see is everybody trying to be right. And that's when the kids are using it against you because it works. But when you surrender in this way, it doesn't work. Being in a relationship with the client or your child so that they will experience how to be in a relationship in this new way. So it's not about what you teach, it's about how you are with them. That's what people learn. And I love, my favorite work in the last few months is when I'm working with parents whose children are still struggling. I don't love that part of it, but when the children are still struggling and the parent just has a different feeling about them. I had a parent recently whose child had to be hospitalized. She didn't even call me. I found out about it during our session on the following week. And she talked about it with curiosity, with patience, with this is where we are. It's been a few weeks now, and now she's talking about it as one of the best things that ever happened to them. So, and that's just what was needed at the time. So when people can deal with that kind of chaos and getting to the point where you have to hospitalize your children, as many of you know, can be a traumatic event, realization, turning point. But this parent that I've been working with for a couple of years got to the point where she was at peace with it. And she didn't say she was at peace with it. She just was at peace with it. That's a different kind of way of being in relationship to a child's depression or suicidality or whatever it is that gets the child into that kind of a situation. And that's the thing that does the most to affect the child. Because when a parent runs around anxious and trying to control things, the child at an unconscious level understands that something is wrong with them, believes something is wrong with them. Learning to not know, learning to not have the answers. What a joy it is to your children when you don't have the answers. What a joy it is when you are the student. Then they're not the only one who's stupid in the family, who doesn't know, who gets it wrong. How much safer of an environment is it when we can all show up not knowing, not being right? Seeing in a pebble or a dust particle the entire universe, seeing the wisdom, joy, and the light, and the strength in the problem. I wouldn't wish any of what you all are going through and have gone through, I wouldn't wish any of that on you. But it is what's happening. And so the idea is, can you see all of it? Can you see the flower in all of it? Can you see the universe and the sunlight in all of it? Mindfulness will result in the cessation of behaviors that cause suffering in you. Right? The parents that really are drawn toward this work are the ones who have allowed this work to change them the most. Yes, in many cases they've had great outcomes, some not, in terms of their child's healing and rehabilitation. But the ones who have allowed this work to change them are the ones who are drawn to it for the rest of their life, who it changes their life. And by the way, when that happens, I had 2 parents report to me this week that their children said to them, I can see the change. You're doing a nice job. And that's a wonderful feeling. Do not be angry at your anger. Have compassion on your anxiety. You know, I'm so angry, frustrated with parent shaming in the world. Right? As if these people that are raising children who they themselves have a wound are going to benefit from us shaming them and being angry at them. Yeah, you're a helicopter parent or a snowplow parent or an anxious parent or a controlling parent. Okay. But you're that way because you're wounded. You're that way because you don't know how to be another way. It's too scary, too uncomfortable, too terrifying. Doesn't make sense to be another way. So if I insult you or make some if I make some condescending comment that's cloaked and clinical cliches, and somehow I'm benefiting you, absolutely not. So just like with our students, we try to see the wound in the parent. But again, it takes courage to look at that for parent. That's the heroic journey. That's the heroic parent. The parent who can look at that. One of my children just recently came home from a therapy session with my own children, with a group session, and it was their first group session. And I think it was one of my happiest moments, most impressed moments, above all of the kinds of accomplishments, that they went into a group, told their story to peers, opened up, and allowed for that beautiful process to happen, and came home okay. I can't think of anything more courageous. And I read a story some time ago about a young man who avoided telling his parents that he had a problem with drugs and alcohol. Finally admitted it, worried that his parents would be ashamed. He had a brother that was successful and accomplished in many ways. And the parents simply said, I've never been more proud of you in my life. You know, that's the heroic stuff. It's not being successful and accomplishments. Those are wonderful talents that we're lucky and blessed to have. It's doing something emotionally risky and hard. It's opening yourself up. It's exploring your shame. It's looking at your faults. It's considering your contribution to the problem. And then being able to parry off and keep at bay the shame that often comes along with that because of our own childhoods and what they taught us. That's the heroic journey. The client or child is the teacher, and therapy must be a collaboration. This is something we do together, not that I do to you. And yes, this program works. This program is beneficial. These children are not safe. It's not working at home. You're allowing them to get something here that they can't get at home because it just doesn't work there. So once we've established that, then jump into it with them. Keep up this work, ideally for as long as you live, as long as you breathe. Mindfulness is an everyday activity. It doesn't have to be with a robe on, sitting on a pillow, breathing. It's about being present with what is, feeling and embracing what is, learning from, treasuring, getting value out of what is. And then this idea of impermanence and death. You know, this isn't going to last forever, this earth life. Right? We're going to be here for just a short time. And when we realize that, maybe we might take an opportunity to taste the sweetness that is the present moment and today. Thich Nhat talks about this idea that the therapist must give birth to the therapist inside of the client. Several times over the past several months, I've noticed this idea that a parent has this advice or solution or suggestion to their child that they may offer to them in a relatively kind way. And what I'm aware of when I'm hearing this story told to me is, hey, Dad and Mom, I know you're a good problem solver. I know you're capable. That's not the problem. The problem is your child's not problem solving. They're not becoming resourceful. So yes, the answer you gave them was a great answer, but it's not their answer. And in some ways, they're going to need to arrive at that answer in a very crooked way, not in a straight line, not without pain and struggle and mistakes. For some of them, as you know, as their parents, it's going to take an excessive amount of mistakes. And so our job is to develop the capacity to involve ourselves in the resources, the interventions that can provide some safety during this process, support for us, support for them along the way, so that we can help them give birth to the therapist that's inside of them. So those are my thoughts from Thich Nhat Hanh's book, Mindfulness and Psychotherapy. You're welcome to, like I said, it's not a written book. I can't find it anywhere written. It's just an audio book. It's about 3 hours and 20 minutes or so, give or take. If you have any interest in it, it's a fantastic listen. All right, I'm happy to answer any questions if there are any on topic. No? All right, let me go over some announcements. Then if you have any questions, I'll get to those. We want all parents to go while they're with us to 6 12-step support groups. Just try it. Note it's there. It's free. There's not a lot that's free. This is one of the programs that we know that is most helpful for people who have loved ones who are suffering, not just from alcoholism and drug addiction, but from any other self-sabotaging, self-harming, self-defeating behaviors. Just translate the drinking into other behaviors and it can make sense. You can also go to NAMI.org. That's the National Alliance of Mental Illness. It's a national organization that can help you with resources and free classes. You can listen to these broadcasts live, of course, via webinars. If you're an Evoke Therapy family or an alumni, you can also listen to them on podcasts, and these are free to the world on podcasts. Go to your iOS device and search Evoke Therapy programs in the iPod app, podcast app. And if you have an Android device, download the SoundCloud app and search Evoke Therapy programs. Follow us on Twitter and Instagram for announcements, inspirational stories, and pictures. And on Facebook for longer articles and links and resources, search Evoke Therapy programs. You can find the Second Nature Alumni Foundation on Facebook. It's an organization that parents have founded to help people that can't afford therapy. And then we, of course, have our blog. My book, The Journey of the Heroic Parent, is available on Amazon or BarnesandNoble.com. It's also available on Audible or for CD purchase, so you can listen to it while you drive. The podcast, by the way, you can download them and listen to them when you're out of range, out of connectivity. The Parent Alumni Foundation book page on Amazon through the Amazon Smiles program. Same price for the books that are recommended by Evoke therapists, but a percentage of the proceeds goes to people who can't afford therapy. taking July off for the parent support groups. The next intensives and workshop, we're starting a new intensive on Monday. I think we have one spot left. We're full enough, but if you have a last minute ability, you're welcome to come July 17th through 20th. The next workshop that we invite all parents to is July 29th and 30th at Entrada. You can coordinate that with a field visit if your therapist thinks it's appropriate timing-wise. We would like all parents, all current parents who possibly can go to one of these workshops to go. If you want to do deeper work with me in smaller groups, that's the Finding You intensives. We also, of course, have one coming up in Toronto, and I run those. We also have private intensives for families. Pursuits trips are therapy light, sober fun. It can be for families or young adults. You can go to our website for more information. And I'm happy to take any other live questions before we wrap up. No questions tonight. Hope that means it was accessible. I'm going to talk next week on Monday the 17th after I get out of the intensive at 7:30 p.m. Mountain Time, a little bit later. I'm going to talk about running away, both literally running away, because that happens sometimes in our program, but also the idea of running away from our problems and how we use that process with the adults and with the adolescents to help bring them back to themselves, to help bring them back to the realization of dealing with the here and now, of dealing with the issues that they're presented with in their life. All right, folks, I'll talk to you Monday night. Have a great and safe weekend. Take care. Bye-bye.